We're now 24 hours from removing the lateral femoral cutaneous nerve. This patient's nerve had been compressed for quite some time at the lateral hip. He had had several procedures to try to denervate this with with radio frequency ablation, and it was successful for a few months at a time, but this pain would always return. So can you describe to us what your pain was like prior to this? We're only 24 hours and the numbing medicine has worn off, but what were you dealing with prior to having this nerve removed? What did it feel like?
Oh, prior to having this nerve removed, it was debilitating. The last couple months have been really bad, but I've been dealing with it for years.
Just describe the symptoms.
It just feels like a knife is right in my side.
Mm-hmm.
The burning just wouldn't stop.
And where did your burning travel? Or where was your burning?
It went down to the leg and then back to the hip. So.
Okay, and the radio frequency ablation worked and the nerve blocks worked, but it was temporary, correct?
It was temporary, and we couldn't get all the branches when we would do RF, so doing a resection was pretty much the only option, and I'm so thankful that I did it.
Thank you. The patient did have 4 distinct branches, and it's certainly possible that the radio frequency ablation was done too far distally and would not cover each branch, depending on how far the signal spread for the ablation. What is numb? If you don't mind seeing us stand up and just show us on top of your pants there, you can just show us what is
Just
actually
have my
numb.
bandage, but I'm numb from here all the way down to the knee, and then it comes back over all the way to the side hip of the butt.
So it looks just like that blue area.
Correct. Exactly like that blue area.
So
Before, I could never get this numb from the ablations, only the leg,
Okay, very good.
because of there being 4 branches.
All right, well, it's obviously very early, but we will be eager to follow up. This will get smaller with time. The numbness shrinks with time, but the area that was painful is now numb, and we'll see how things go in a few months. Okay?
Thank you so much.
Yep.